Hello and welcome. Our presentation is on aromatherapy and it's going to be focused on patient teaching. My name is Pam and I'll cover the first portion of our presentation relating aromatherapy to patient teaching. The remaining portion of our presentation will be covered by Kate, who will incorporate our patient with Betty Newman's theory. Our patient is 38 weeks pregnant with her second pregnancy. Her first pregnancy ended in miscarriage at 15 weeks. She's anxious about the delivery due to her previous miscarriage and she's worried about the pain of labor. Ivy has had occasional nausea and vomiting throughout her pregnancy. She has had no concerns with her blood pressure and she's tested negative for gestational diabetes. She wants to use aromatherapy to help with occasional nausea and vomiting that she's experienced and she's afraid might reoccur during labor. She has been reading about the benefits of aromatherapy with labor and delivery and wants to know more information on how aromatherapy can help during labor. She's also concerned about the possible depression that she may experience after delivery and wants to know more about how aromatherapy can help with postpartum. Studies have identified the benefits of using aromatherapy during pregnancy for reducing nausea and vomiting and anxiety and depression. 2 studies included a double-blind randomized clinical trial that indicate the benefits of decreased intensity of nausea and vomiting with the use of 3 drops of lemon and peppermint placed on a cotton ball and inhaling 3 times deeply when feeling nauseous. The second clinical trial compared inhalation of rose aromatherapy to metoclopramide in relieving anxiety and depression related to nausea and vomiting. The results demonstrated by the end of the 5th day was an improvement with the rose aromatherapy group compared to the metoclopramide group with decrease in mood swings. Aromatherapy has also been shown to be helpful during labor and delivery. A study using aromatherapy for the discomforts of labor with a review of literature found the use of citrus decreased anxiety during the first stages of labor. Peppermint, ginger, and citrus peel also decreased the nausea associated with the labor and delivery process. Lavender oil that was rubbed on the abdomen and the backs of patients was also found to decrease the perception of pain, which in turn decreased the duration of labor. The study identified the method of delivering the aroma of the essential oil was through placing the essential oil on a piece of gauze and then pinning the gauze to the patient's gown. The peak effects were identified after 30 minutes of smelling the oil. Once the peak effects have occurred, then the gauze should be removed after 20 minutes due to saturation of the olfactory receptors. Caution should always be applied when using essential oils. They should always be used with a carrier oil such as almond or fractionated coconut oil. They should never be used on infants younger than 3 months of age, and they should never be placed in birthing tubs due to the risk of aspiration by the infant. Essential oils have also been shown to relieve episiotomy pain, nipple pain, and postpartum depression. A randomized clinical trial identified the use of lavender showed a reduction in episiotomy pain and inflammation compared to placebo. A systematic review identified the use of peppermint oil was beneficial in reducing cracked nipples due to breastfeeding. The peppermint water was applied after feeding and then washed off before the next feeding. A systematic review using lavender, rose, and orange identified aromatherapy improved postpartum symptoms that included depression, fatigue, stress, anxiety, altered prolactin levels, and in turn increased the feelings towards the baby, leading to improved mother and infant bonding. A review of the essential oils that were identified as beneficial throughout the research articles presented. Lavender was shown to be helpful in wound healing. Lavender contains linalool, which promotes the relaxation. Under the lavender slide is a link to information on lavender that includes a 4-minute video. Peppermint has analgesic and antimicrobial properties, but caution should be applied when using peppermint and it should not be used on children under 30 months of age. Use peppermint cautiously on the skin because it can irritate the skin. Orange was shown to relieve symptoms of postpartum depression. Orange contains terpene, which supports the energy levels. Orange has antidepressant effects, but can also cause phototoxicity up to 18 hours after application. Rose was shown to help with stress, depression, insomnia, and anxiety. Clary sage should be used with caution due to the enhanced release of oxytocin. Clary sage contains sclerol, which is a form of estrogen, and was shown to increase uterine contractions but did not shorten the duration of labor. Lemon was shown to be helpful with nausea and vomiting. In patient teaching, when using aromatherapy or essential oils, they should always be applied with a diluted carrier to prevent skin irritation or skin breakdown. Essential oils can be added to inhaler sticks or diffusers. The essential oils can also be applied to the wrist or the soles of the feet. Other information on patient teaching: when using essential oils, it's very important when choosing the oils, they should always be free from pesticides. Some essential oils will interact with medications such as blood thinners, and some essential oils can cause a hypoglycemic effect. Essential oils should not be used near transdermal patches, as this can increase the medication absorption rates. Essential oils should also not be used near the mucous membranes and should be used with caution in people with asthma or skin conditions. This information is related just specifically to pregnancy and delivery when using essential oils. Essential oils can be toxic and in some cases can induce contractions. There are various varieties of lavender, and the plant breed should be evaluated before using any form of lavender. Certain essential oils can stimulate estrogen production, such as clary sage that was mentioned earlier. Essential oils should not be placed in birthing tubs due to the risk of aspiration. Essential oils come from different parts of the plant, such as seeds, which includes black pepper, sweet fennel, stems, leaves, and needles, which include rosemary, peppermint, and pine, petals and flowers, which include clary sage, chamomile, and rose, rinds and fruits, which include lemon, mandarin, and sweet orange, wood and resins, which include cedar wood, frankincense, and sandalwood, roots and rhizomes, which include ginger, and grass, which includes lemongrass. Now I would like to turn the remainder of our presentation over to Kate, who will present Betty Newman's theory with our patient and how she transitions through different phases in her life.
Thank you, Pam. Pam and I decided to use the nursing theorist Betty Newman. We felt that Betty Newman's system model is a nursing model that uses holistic and systematic views to explore the effects of stress on the individual, as well as the individual's ability to regulate and rebalance. Its main characteristics are reliability and integrity, which presents a comprehensive and integrated conceptual framework based on a systemic view of care and holistic for the family, the child, the woman, and her environment. The major concepts of Betty Newman's theory is prevention. Depending on the person's reaction to their stressors, we can use primary, secondary, and tertiary preventions may be needed. Primary prevention focuses on protecting the normal line of defense and strengthening the flexible line of defense. This occurs before the system reacts to a stressor and strengthens the person. In our patient scenario, Ivy is the pregnant patient who moves throughout various stages of stress, from the time she discovers she is pregnant through to her labor, delivery of their child, and through her postpartum transition. Secondary prevention focuses on strengthening the internal lines of resistance, reducing the reaction of the stressor, and increasing resistance factors to prevent damage to the central core. This occurs after a system reaction to a stressor occurs. So even with the use of non-pharmacological stress reduction, pain and anxiety reduction, and decreased depression symptoms, as nurses, we need to apply the appropriate nursing theories into practice to assist in the biopsychological context of the family, the environment, and the patient. Tertiary prevention focuses on the readaptation and stability and promotes reconstitution or return to wellness after treatment. We couldn't think of a better nursing concept or nursing theorist that would fit a woman going through each stage of pregnancy and also her own changes than Betty Newman. Betty saw the nurse as a key role and player during a woman's transition through pregnancy, labor and delivery, and during the postpartum care. As the nurse, we need to look at the patient or the person receiving the care, the health of everyone involved for their wellness and well-being, and also their environment, whether that be their family environment, internal environment, or the building environment. Applying these nursing theories within nursing care is an effective and evidence-based way to promote and achieve optimal outcomes. As we've said before, transitioning to motherhood is stressful for a woman. There is constant anxiety through pregnancy, labor and delivery, and postpartum. Nurses can use aromatherapy to significantly reduce the stressful environment, their personal stress, and the recovery stage that each woman can go through with essential oils. Helping and teaching a woman how to handle her own stressors at each stage will help her during that postpartum period and transition her to a new mom. Precautions that nurses need to know are each oil brings a different precaution to each woman. Topical aromatherapy has become very fashionable in use in pregnancy and laboring moms, but we need to also remember that it can do different effects on different women. Allergic contact dermatitis was the top precaution and the top reaction to essential oils. We need to be monitoring how these affect women who are on differing medications, skin changes, and also we don't want to cause any new symptoms or signs that it could interfere with anything that the woman is going through during her pregnancy and delivery. Resources for nurses. This is a guide if you are going to use aromatherapy during your practice. These are great resources to look up and to see the safety and different ways that aromatherapy and essential oils can be integrated into your practice. To wrap everything up, aromatherapy scents and oils can be most beneficial for management of pain, nausea, vomiting, anxiety, depression, stress, and insomnia during each phase of pregnancy. Aromatherapy can be used in the home setting and the clinical setting. As nurses and providers, we need to be aware of how to incorporate the essential oils into each stage of pregnancy, labor and delivery, and the postpartum period. It is important for nurses to use the nursing theories in order to look for the most current knowledge available to practice care for the patient, family, child, and community. Nurses should be aware of the potential side effects of allergic contact dermatitis with essential oil use during pregnancy stages, paying careful attention to the effects on the self, the baby, and the environment. The use of aromatherapy in pregnancy during the pregnancy process is composed of stages which build on the process of care for the woman, child, family, and her environment to maintain balance and well-being with optimal outcomes. Thank you very much for your time.